In this presentation, we will demonstrate the proper procedure to form and fit a NiteBite. The first step in the insertion of the NiteBite is to heat water to approximately 170 degrees. Once the water has reached this temperature, place the NiteBite into the hot water until it turns completely clear, about 30 to 45 seconds. A second NiteBite has been placed in earlier to illustrate how the NiteBite should appear when it's ready for insertion. As a thermoplastic resin, it's reversible. It can transition from opaque to clear and back again depending on the water temperature or the room temperature. An alternative heating method is with a microwave set to approximately 30 seconds. Place it in an open case covered with water so it is completely clear on removal. Once the NiteBite becomes clear, remove it from the water bath. You now have approximately 2 minutes to fit the NiteBite into the patient's mouth and remove it for the first time. Quickly insert the completely clear NiteBite with the centering notch lined up between the two maxillary central incisors. Press up firmly with your index fingers and thumb. Hold the NiteBite firmly in position. During this time, while holding the NiteBite in position, you can mold any excess material lightly at the gums and around the palate. Do not let the NiteBite move laterally, forward or backwards. Ensure the incisal edges are seated fully into the bottom of the NiteBite. The NiteBite will slowly change back to opaque color. The patient is not to bite on the NiteBite. Do not place excess pressure on the palatal portion. Just let it sit passively with firm, even upward pressure of your forefingers or thumbs. At the 2-minute mark, immediately remove the NiteBite. Do not skew the removal to either side. This initial removal will assist in clearing material from any extreme undercuts, diastemas, restorative, or anatomical contours. Inspect the inner surface for a complete impression of the teeth, gums, and palate. After inspection, replace the NiteBite immediately back into the patient's teeth in the same position as before by pushing up firmly and evenly. Keep in this position for approximately 90 seconds. During this time, the patient can hold the NiteBite in position by pushing up firmly with their thumbs. After 90 seconds, allow the patient to take the NiteBite out, instructing them to pull it straight down and out of their mouth, then to put it back in. Ask the patient to try and remove the NiteBite by using their tongue or lips, closing their lips, and working against the NiteBite. They should not be able to dislodge it, indicating it will stay firm and in their mouth throughout the night. Continue examining to ensure proper fit. Ask the patient to tap several times on the back of the NiteBite with their mandibular incisors and to close in the far back retruded position. Now instruct the patient to slide to the left, then slide to the right while keeping the mandibular incisors in contact with the NiteBite. Return to the retruded contact center position. Make sure there is no posterior or lateral excursive contacts. Remove the NiteBite and examine the full inside impression. Note the anterior indents, particularly the centrals and the laterals, as much towards the distal as possible. Notice how thin and almost transparent the NiteBite is at the incisal edges of the centrals. This is key for the bite to fit entirely inside the patient's freeway space and for maximum and comfortable retention. If incomplete or deformed, the NiteBite can be remolded from the beginning steps by reheating and molding with your fingers into a center pyramid shape and reinserting in the patient's mouth. Following these simple step-by-step procedures will ensure a proper fit, use, and function of the NiteBite.